We are talking about health. We are talking about kidney. Now, barring any last-minute hitch, Ghanaians whose kidneys are damaged can have it changed with a functioning one from a donor. A law which will allow organ donation and transplant is expected to come into force by the end of this year to help deal with persons who need to replace their damaged kidney, eyes, or even heart. It is part of a wide-ranging measures set in motion by government in response to the rising cases of kidney disease among Ghanaians. Now, Presidential Advisor on Health, Dr. Anthony Nsiah-Sarem, has been sharing details at an event where a new initiative dubbed Healthy Heart Africa was introduced today by vaccine manufacturer AstraZeneca in partners with the government to deal with the rising kidney problems.
Working around the clock with the Minister of Health, there's a draft document which has been sent to the Minister of Health by a group of health professionals who have interest in tissue and organ transplant. So there should be tissue organ donation and transplant law so that people can donate, for example, their eyes for cornea transplant. They can donate their heart, they can donate their kidneys or whatever if they have an accident or in case of accident or in case of death. We should have a law passed by Parliament, out of Parliament, to back it so that there will be no legal issues of organ donation and transplantation. And this is what we are working together with Ghana Health Service, with the Minister of Health, to make sure that we have a policy, we have a legal document which will go through Cabinet to Attorney General, will put it in a legal language, and go to Parliament to be passed. We are working very, 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 very hard that we get this thing done before the end of the term of this present Parliament, which ends at the midnight of 6th of January 2025. So we're hoping that we'll get. They say that the most important thing is getting the document together. The document, a very good document, has been prepared, which is at the Ministry of Health. What is left to be done is that a group of stakeholders have to meet, go through the document, and then the ministry then prepare the document, the policy document, which will then be launched, and then it will be taken to Cabinet for Cabinet to also approve it and send it to Parliament for the law to be passed. So there's a series of things to be done, but I'm very hopeful that with about 9 months left, we should be able to do it and pass it before this Parliament recess.
Now, Deepak Arora is Africa Cluster Country President at AstraZeneca and has been explaining the new initiative.
Integrating along with hypertension screening and diagnosis, also chronic kidney disease. And as you know, 11% of these patients are suffering in Ghana silently. By improving screening and diagnosis, what you're doing is you're building capacity and capability of early screening, diagnosis, and treating these patients so that they don't progress into last stage of chronic kidney disease, where we know they end up into dialysis. And dialysis is very, very expensive. A lot of healthcare burden goes into it. We have been doing Healthy Heart Africa from last 2019, and we've screened around 9.6 million patients. And now what we're doing is bringing chronic kidney disease also part of the NCD prevention. Ghana is the first country to launch Healthy Heart Africa 2.0 versus the other countries which are already executing Healthy Heart Africa. So we're starting with Healthy Heart Africa 2.0 in Ghana, and then we'll be moving to other countries as well in Sub-Saharan Africa. So very, very excited. The impact is about prevention. The impact is about bringing healthier outcome, halting progression of chronic kidney disease in the patients who have a high risk because of hypertension and diabetes.
Well, the new code will be implemented by doctors working under the Ghana Health Service. Dr. Akusia Sapon is Greater Accra Region Director of Health Services and has been explaining how the new guidelines will be implemented in this regard.
I'm so excited with this guidelines or protocol introduction. You know, hitherto people end up having the end-stage kidney disease, which will mean that they will have to go through dialysis with this attendant cost to the country to families and to individuals. And we know that there are some risk factors or certain conditions that predispose people to this chronic kidney disease. And one of them is hypertension. Hypertension prevalence among the adult population is over 30%. Yet a lot of people walk about and they are hypertensive, but they don't know their status. And therefore, their kidneys gradually get damaged. And if they are not recognized early, or identified early, or diagnosed early, then they end up with end-stage kidney disease. But with the introduction of this protocol, there are levels of kidney disease: stage 1, stage 2, stage 3, stage 4, and so on. And if we implement these guidelines, we'll be able to identify the stages early enough and intervene and treat, and therefore prevent people from getting into the end-stage chronic kidney disease, which end up with dialysis and ultimately kidney transplants or kidney transplantation. So I'm excited with this protocol. It means that our facilities at every level, can read the protocol, understand, and then start implementing, and therefore we'll be able to integrate it into our routine health service delivery. So it is good. We are going to ensure that this protocol is disseminated to all the levels of care, right from our regional hospitals to our district hospitals to our health centers and CHIPS facilities, so that they understand and then start screening people early to identify early disease for management, so that they don't progress into the end-stage kidney disease.
So this is very good news, especially if you are suffering kidney and you are going to dialysis treatment. Now, the good news, as we heard from Dr. Nsia Sari, and of course, Deepak, who is here with me in the studio. I mean, it is good, whichever way you look at it, but how is it going to work? I'm joined in the studio by Professor Samson Entry, President of the Ghana Kidney Association. Also with me is Deepak Arora. He is the African Cluster Country President at AstraZeneca. You're welcome, gentlemen.
Thank you so much for having us.
Yes, great. So, Prof, let me start with you. This will be a very welcoming news.
Yes, it is, indeed. I think Ghana Kidney Association, thanks Joy FM. Last year we had a dialysis crisis. We were in the news. We all worked together to try and create awareness and advocate for some intervention by government, and I think something happened subsequently.
Right.
Polibu is running it at an affordable cost, the dialysis. But like Dr. Sapon said, our focus as a professional group is not to wait till people get advanced kidney disease. That will definitely be a defeative approach if you go that way. And so to educate people on the risk factors of chronic kidney disease, advocate for early screening, early intervention, and this will slow down progression to the end stage, where it becomes very costly because we need dialysis or transplants. And so Ghana Kidney Association, one of our major missions was to try and develop a protocol or guidelines that we made available to all cadre of health staff in the country, so that they will identify those at risk and then screening procedures and how to diagnose CKD and what we can do.
This afternoon, for example, I got to understand that usually when people report at the hospital, they are always at the end stage of it. And it's difficult to reconstruct or restructure whatever is left of it.
Yeah, at that point, treatment becomes very difficult. And like Dr. Sapon said, so there are 5 stages of kidney disease. If you are stage 1, that's the earliest stage. We can say you have got CKD, chronic kidney disease, but your function is correct. Your kidney is functioning very well. So at that point, if you intervene, for example, if the risk factor is hypertension or it's diabetes, and you control the hypertension and also control your blood sugar, then it will take you a long time before you get to the end stage.
So you can live comfortably. Without
yes. We have seen people who are diabetic because they are well controlled. Probably 20 years, their kidneys are intact, controlled. And but if people don't know that they've got hypertension because they are not screening, they don't get their BP checks. Somebody hasn't gone to hospital for probably 5 or 10 years.
Yes, and he feels that he's very okay.
Yes,
because,
okay.
Yes.
Hypertension will also not give you symptoms. When it gives you symptoms, it's killing you. Probably get a stroke. And so we are just advocating for people who are at risk to have screening done. So that if we screen you and we identify a problem, either it's blood pressure we are checking or blood sugar we are checking, and we have got any of those problems, interventions are done. And so this protocol that we have developed with our partners, and we are very grateful to AstraZeneca for funding this one, is done for Ghana Health Service. So they are going to own it. And it is going to be disseminated down to all the levels of care, from the CHIP compound to the primary health care coming up, so that healthcare workers, when people come to hospital, they will see this person is at risk because of it's free. If you are huge and your body mass index is even high, you have a risk factor, things like that. If you take somebody's history and then you get to know that there's a family history of hypertension, the father or the mother have got hypertension or diabetes, you're also at risk. You need to screen. In fact, age itself. Once you get 40 years old,
it's a factor.
It's also a risk factor.
You are at risk.
So those are the key things that are highlighted, so that together, collectively, we can identify the at risk. We screen them early. Simple tests that we can do, within just collecting your urine.
Okay.
And actually detect that.
We'll come to talk about what you launched today and how that benefits those who are going through treatments and those who don't know their status and what they can do to get ahead of this particular matter. But Deepak, how does AstraZeneca come in?
AstraZeneca is a global-led biopharmaceutical company, and now is a household name after COVID-19, right?
I remember two shots of it.
And I think one of the passion which our CEO has is about equitable access and playing a role giving back to the society. And I think important piece is about AZ, AstraZeneca, and sustainability. And it's not new. If you look at AZ Forests, which was being done in Ghana for years, where we have planted around more than 4 million plants. So it's giving back environmental protection. Then picking up some of the non-communicable diseases, which has very low awareness. And that's what Professor was talking about. Till the time you get to know you are in the late stage of chronic kidney disease. Till that time you get to know you are already into, from diabetes, you are at the stage where you will be using insulins. Till you get to know you are into couple of poly pills for hypertension. So how do we empower the primary health centers and enable the patients and the caregivers and family who take health in their hand? That's something which AstraZeneca is working from a sustainability aspect.
So this is your role?
Yes, this is our role. And it's not, I think one thing which is very, very clear is that we can't do it alone. Right. And that's why the public-private partnership comes into practice with societies, with NHI, with the Ghana Health Services, with government, coming together and seeing where we can join hands to make sure that we halt the progression. And we don't talk about treatment always, we talk about prevention.
Right.
And that's why Healthy Heart Africa has been running for the last 10 years. We just celebrated a decade of celebration for Healthy Heart Africa.
Right.
And now we are bringing chronic kidney disease because that's an alarming burden which is erupting like volcano in incoming.
So I just want to find out how you are playing this role.
What we're doing is we're bringing the idea with the expertise and saying how we can handhold to bring this screening at a mass level. And also create awareness programs by building capability of training the healthcare professionals through the protocols, guidelines, and at the same time bringing awareness along with joy in terms of going to every household and say, if you have risk of hypertension, if you have diabetes, do not miss out on getting screened for chronic kidney disease.
I think this is very important. I remember, awareness about kidney became quite pronounced after the Kolebu Teaching Hospital. And I remember even in the newsroom, everybody wanted to know, so what should I do to prevent me from damaging my kidney? And I think one key matter that stood out was the fact that you should take a lot of water. And then next everybody had a bottle of water by him or herself. So it means that people, they dread the disease, if you like. But we don't take the responsibility of knowing our health status. And that is a general Ghanaian problem. So how are you hoping to drum home this awareness creation such that people will become more alive to their health responsibilities?
Thank you very much. So, of course, what we are doing is part of it, working with the media to try and let people know what are the risk factors. So if you hear us and you know that definitely your body mass index is high and you're obese, you are at a bit risk of hypertension and diabetes and therefore kidney disease. So that's fine. But what this, let me just part AstraZeneca, they've done quite well. I mean, a pharmaceutical company, you would think that they are interested in manufacturing drugs to treat people.
Of course.
But here, they are hammering home prevention, screening for prevention. So that is very magnanimous on their part for doing that for us. What this protocol is trying to do, because it's going to be made for Ghana Health Service, it's going to be made available at all levels of Ghana Health Service. It is there. Healthcare workers who are there, when people come to hospital, they will know that probably you got the risk factor. And then they will know the simple thing they can do at their level to detect whether you've got chronic kidney disease or not. If you have gotten, there are also instructions. What do you do up to the point where you will need to probably refer to a higher level? That is how this is coming in for people to know their status. But other support we also get from partners like AstraZeneca and the rest is that there are a lot of health days worldwide that we do. Just last week, we celebrated World Kidney Day. When those days come, we do a lot of screening. And we partner them. They support us. They sponsor us to provide a lot of logistics for us to run these things. So doing screening, doing just health screening on days like that, whether it's a cardiovascular or diabetes day or kidney day, are also very important ways. And we are not just doing the screening. We also do the education. For me, the key things are the risk factors. So if you have the risk factor, probably you haven't got an advanced kidney disease, yes. But if you've got a risk factor, and then you come for screening, a very simple test we can do to screen, then we can identify you early and put in prevention.
I mean, and the issue of our cost will be a concern for many. And I'm sure a lot of people are asking, how much would it cost me to do the screening?
Okay. So they are very simple, very low-cost tests that you can do. Checking your blood pressure. Let me say this. During the diagnosis crisis, I think the ministry representative, doctor from Bono East region, that was when I even got to know about this wellness clinic that Ghana Health Service has created. Well, you don't need to be sick before you go there. You just walk there and say, I want to just check my blood pressure, my sugar. You understand? So those ones are not expensive. Going to check your blood pressure and going to check your sugar, I'm told that they are working even to get Ghana, the health insurance
to cover it.
That. So that anybody, at least once in a year, if you are not being sick, you can go there, get your blood pressure check and your sugar. But simple tests like your urine, collect your urine. There's a stick, you dip into the urine. And if you have got a chronic kidney disease, it will show. And that can be as low as 2 cedis.
Right.
2 cedis. So it's not that expensive. Checking your blood pressure may not cost anything. Checking your sugar may not cost. And just doing your urine may also not cost, even though there are blood tests that we can also do. But these simple ones I've said are very key things.
So AstraZeneca, is this a social responsibility program?
Yes.
What really is the motivation?
I think motivation is in terms of bringing the outcome and improving the outcome of the patients. I think 2 statistics I was very amazed to hear and brings a lot of risk is 70% of the patients or people do not know about hypertension.
Of course.
And then 75% of the patients who are at the risk of
disease.
Chronic kidney disease, they reach at the stage 4 in the hospitals. So if we can delay the progression by just a simple screening, a simple awareness, knowing that if you have these risk factors, do not ignore, because that will be expensive. Not a screening is expensive. Not getting a simple test is expensive. What is expensive is if you are ignoring your symptoms and the risk factors and you land up in the tertiary hospital, it's going to be very, very expensive. So this is just a kind of a motivational aspect which AstraZeneca got it, along with the partnership of societies, that we can do a lot together. And we've seen it. We've seen it in the last 10 years where we were and what we have done with hypertension. Adding chronic kidney disease will be making sure that we delay the progression and helping our families, because we are also patients. today or tomorrow.
Of course.
Right? So if we have the health in our hands, why not the families and people of Ghana and Sub-Saharan Africa doing it as well?
And has this started already?
So today was the day of kickoff and launch of Healthy Heart Africa 2.0. But as I said, Healthy Heart Africa has been there for 10 years.
Right.
Now we're integrating CKD screening as well along with it, because we know that's the biggest burden we see. And because we don't have experts like him, we have to replicate experts like him, which will take time. So what we need to do is we need to bring this feed into the primary health centers, and they become nephrology support as the professor and start screening these patients, and if they have risk factors, start treating them there itself.
And are there identified places that this is taking place, or all health institutions?
For the guidelines we have developed it in partners for Ghana Health Service, and so they are going to print more copies and different levels of care. So it depends on your level, where you are. If you are just a physician assistant or a nurse or something, a different level. So that will be made available. Not very big book, very written in a very simple language, so that it is there for people to just look through it. So that when somebody comes to hospital, you can see that this is what I need to do at this level.
So I think it will be all primary health centers.
Right.
That's where we will be pushing the protocols, guidelines, educating, building capability with the paramedic staff, nurses, and the physicians. And then they will be capable enough to identify the risk factors, screen them, diagnose them, and then send it across to the secondary or tertiary centers.
And you are targeting everybody.
Yes, the public. Because that's what we will get to know, what the real incidence of chronic kidney disease is. Because hypertension is very, very prevalent. Diabetes is very prevalent. If these two are, that means for sure chronic kidney diseases.
Prof, before I let you go, maybe your final advice to people who are watching, and they're thinking, tomorrow I'm just going to carry my bag and walk to a health center and have it checked.
Yeah, for sure. So I think our health-seeking behavior needs to, we need to up our game a bit. Somebody will be boasting that, as for me, I haven't gone to hospital for 10 years.
Yeah.
I don't think those are the things we need to be saying. I haven't gone to hospital for 10 years, and you are boasting in that. You don't need to boast in that. At least once a year, if you are not even sick, just go to hospital. And the thing is that once you are growing above 40, naturally,
you are prone to a lot of things.
Hypertension, diabetes, and those things. So let us all take our care quite seriously and offer ourselves just for checkup. But once again, I will end by talking about the risk factors for CKD.
Sure.
So if you are obese, your frame is huge and you're obese, you are a risk factor. If you have been told that have hypertension, don't just ignore it.
You may not exhibit fatness. Your body index system, you may look slim according to your own standard, but you may be obese.
You go and measure, yes, you want to go and measure. So it's important, just you are weighting your height. So get that one done. Just get your blood sugar check. If you have been told that you have got diabetes, your sources depends on well controlled. If you comply with treatment and your sugar is well controlled, then the risk is eliminated largely. And so do not neglect being adherent to therapy to follow up, things like that. Let us also be very careful about painkillers. I've mentioned it previously in my engagement with the media. Painkillers are dangerous for the kidneys. In fact, nephrologists will rather call it painkillers. We will say they are kidney killers. Killing our kidney. So we are very much worried when even our own colleague doctors are prescribing painkillers for people with this, they damage your this thing. Uncertified or licensed herbal medication is a major problem that we face. People should have these things in moderation, because even orthodox medicine, we know, I'm telling you about painkillers, they can damage your kidney. So in the same way, herbs,
ones that are not tested.
You understand that test can also.
Deepak, your final words?
My final words is all the efforts we are doing will go waste if people do not adapt it. And I think as Sir said, one health checkup per year does not cost you. What costs you is ignoring it, landing into the hospital. So my humble request is, do not ignore your risk factors, which is basically if you are obese, sedentary lifestyle, you have risk factors like diabetes, hypertension, go and get yourself checked. You may be amazed, you may be surprised. So take health in your hands, and I'm sure together we'll make it much more equitable access for screening, diagnosis, and surely halt the progression of such kind of burden.
Thank you so much for your time this afternoon, Deepak Arora, African Cluster Country President at AstraZeneca, and of course, Professor Samson Entry, President of the Ghana Kidney Association. And tomorrow, all of us will line up to have our health checked. Thank you so much for coming.